In this episode, Dr. Raghu Reddy walks through practical, evidence-based guidance for men facing hair loss, combining surgical experience with medical management and lifestyle advice. He frames hair loss as a multifactorial problem driven primarily by genetics and local scalp sensitivity to dihydrotestosterone, DHT, but heavily influenced by modern lifestyle stressors, poor sleep, diet, environmental factors, and in some cases, anabolic steroid use. His central message is early assessment and a staged, individualized approach. Medical therapy and behavior changes first, surgery only when appropriate, and performed by a conscientious, well-trained surgeon. Dr. Reddy explains that androgenetic alopecia occurs when genetically susceptible hair follicles are progressively miniaturized by androgens, chiefly DHT. Genetics were once thought to come mainly from the maternal side, but recent research shows inheritance is more complex. Lifestyle accelerants are significant. Chronic stress, inflammation, poor sleep, and nutritional deficiencies all compound genetic risk. Anabolic steroids can precipitate extreme loss very quickly in men who are genetically predisposed, and younger men in high-stress, high-pressure environments can show rapid progression. Environmental contributors such as sun damage and hard water are also important underappreciated factors affecting scalp health. Dr. Reddy advises that men should seek medical advice early rather than waiting until donor hair is exhausted. Ideally, a consultation with a knowledgeable clinician, preferably the surgeon who would perform any future operation, should occur before irreversible decisions. He generally avoids recommending surgery for men under 30 unless the case is clear and the patient understands long-term planning. Early intervention allows non-surgical measures to be trialed and gives time to plan conservative surgical strategies that preserve donor reserves for the future. Finasteride and dutasteride are central medical tools. Finasteride reduces DHT and has clear randomized data. Reported systemic sexual side effects in trials are low, often quoted around 1%, but in practice appear rarer when patients are well-selected, well-counseled, and nutritionally replete. Vitamin D status, sleep, and general health influence tolerance. Dutasteride blocks DHT more potently and is used selectively. Topical formulations of these agents exist and provide a useful option for men concerned about oral exposure. Topical dutasteride combined with minoxidil or formulations designed for local delivery show promising tolerance with fewer systemic effects. Minoxidil remains useful to promote blood flow and prolong anagen, but it commonly causes an initial shedding phase and requires consistent application. Oral minoxidil is gaining traction for some patients, but needs monitoring for side effects like fluid retention. Non-pharmacological aids such as caffeine creams, dermarolling to encourage penetration and improving water quality, and shampoo choice can complement medication. For many men, a hair transplant is transformative, but Dr. Reddy emphasizes it should be regarded as part of a long-term plan, not a one-off instant fix. The donor area, sides and back, is finite. Overharvesting early can leave nothing for later corrective work. Transplants aim to create an illusion of density using careful selection of grafts, placing single hairs at the hairline, and matching angulation and curl. He explains the basics of graft math. Reclaiming a proportion of the original hair count requires thousands of hairs and a balance between restoring appearance now and preserving donor for future sessions. FUE technique has evolved with more forgiving punches and less trauma, but results depend on meticulous handling, angulation, and time. Longer procedures or staged 2-day approaches reduce graft trauma and allow corrections on day 2. Post-op care includes saline sprays to keep grafts moist, avoiding direct trauma or helmets, limiting strenuous gym sessions until incisions heal, and protecting the scalp from sun. Transplanted hairs often shed before regrowing. Visible improvement is typically apparent after 6 months and continues to mature up to 12 months or more. Dr. Reddy warns of an unregulated market where non-medics or poorly trained operators can deliver substandard results driven by throughput and incentives. Bad work can create long-term donor damage and make later correction difficult. Multiple prior surgeries reduce blood supply and graft yield, so realistic counseling about expected retention rates is essential. Infection is rare when performed correctly, but external trauma or inappropriate care can dislodge many grafts in the immediate post-operative window. He also tells anecdotes illustrating that grafts do not survive long outside the body, making handling speed and technique crucial. Platelet-rich plasma, PRP, and stem cell procedures are discussed with cautious optimism. PRP has attributable benefits in some settings, but Dr. Reddy notes inconsistent study quality and variable results. It may be helpful as an adjunct or for facial rejuvenation, but it is not a universal panacea. Stem cell and cloning technologies are promising long-term possibilities, but are not yet clinically mature. Body hair and beard grafts can be useful donor sources in selected cases, while pubic hair is generally unsuitable for scalp use. Eyebrow and beard transplants are common, culturally driven procedures with good results when done conservatively. Sleep, diet, and micronutrients matter. Vitamin D with K2, selenium, zinc, and copper all contribute to follicle health. Hard water, heat, sulfates, and sun exposure damage scalp integrity. Soft water, gentle sulfate-free shampoos, and midday sun protection help preserve the remaining native hair and any transplanted grafts. Reducing chronic stress and addressing underlying health issues will improve outcomes and reduce progression. Realistic expectations are crucial. Surgery can deliver natural, long-lasting improvements when executed by a careful surgeon and coupled with ongoing medical therapy to protect native hair. Men should expect an initial shedding phase, a gradual regrowth timeline, and the possibility of future procedures. Monitoring, maintenance, and conservative donor management create the best long-term results.